Hi, this is Dr. Nishal, and in this video we're going to be talking about a clinically proven natural alternative for antidepressants. So what's the deal with antidepressants? What is the problem? Well, the problem is the side effects, the adverse effects, the personality changes, the antidepressant-induced sexual dysfunction, which can become problems, especially when you're putting young people on these medications. Well, nobody should be on it, really. Young or old, nobody should be on it. Because there are alternatives that work just as effectively without the side effects. So why isn't anybody on it? Well, you probably don't know about it, so let's talk about it. Firstly, what are antidepressants? How do they work? They function for the most part on a neurotransmitter, which is a chemical in the brain known as serotonin. Now, theoretically, serotonin is, well, I wouldn't say theoretically, the clinical evidence really does show that serotonin plays a very important role in how you feel. And in patients of depression, this tends to be slightly lower. There's many reasons why. Obviously, what's going on in your life, genetic factors, and we actually see in studies that the patients who have the genetic predisposition, that the part of the brain that produces serotonin in them tends to be slightly smaller. Not that there's anything wrong with them. Everybody has some genetic difference, um, and that's just who we are. And some people are genetically predisposed to heart disease or cancer or PCOD, whatever it is. Anyways, so these antidepressants prevent serotonin from being reabsorbed in the brain. And as a result, you have more serotonin going around in circulation. And so the problem is it alters other chemicals in the brain, other neurotransmitters as well. And that's where the problems start. So what can do the same thing that's clinically proven and that doesn't have the side effects? Well, the easiest solution would be St. John's wort. St. John's wort is not side effect free. It does have certain mild side effects, but nothing compared to what happens with antidepressants. It's nowhere near as bad. And St. John's wort is clinically effective. I'm going to post a link to the clinical trials in the description of this video. Now, in Ayurvedic medicine, we don't actually use St. John's wort due to the fact that there are actually stronger things out there that are more effective and more of a permanent solution. And well, in some cases, obviously, it's subjective. So St. John's wort is really not on our list. The reason I've brought that up for you is because it's something that's relatively safe in comparison to the other medicines that you have to use under doctor's supervision. And I know that if I tell you to use it under doctor's supervision, most people are not going to listen. They're just going to buy it and take it. So I'm giving you something that's relatively safe as advice. So yeah, St. John's wort is an excellent choice for treating this condition, and do so under your doctor's supervision. Anyways, I hope this information helped you, and if you'd like to get in touch with me, you can do so through my website, drnishal.com. I do online consults with patients all over the world, and I will see you in the next video.